We know that OCD presents for most people in childhood, even though it may not be diagnosed until later in their life. So sometimes, for kids, it doesn't impact them enough that they need treatment, but it typically presents in a developmental way for them. So kids have normal developmental fears. When kids are young, maybe in elementary school, they're fearful of things like storms or tornadoes, but you're able to offer them typical reassurance and they are able to move on with their day. And OCD is cruel in that it's opportunistic and it's going to take advantage of something like a typical fear, and you're not going to be able to reassure that child. And so I think for kids, you really have to look for those developmental stages and see what's going on in their life and maybe how OCD might cling on to something. The other thing for them too, although we see this in adults as well, is there is this idea that they're shame and that they're crazy because they don't understand the thoughts. Particularly if you have really taboo thoughts, and children can have these just like adults do. You can have intrusive thoughts of harming other people, and think how frightening that could be if you're 9 years old and you're having thoughts of harming your sibling. So in children, we often see them have disruptive behavior with OCD when they're young. So they might have tantrums, or they might become aggressive because they truly don't know what to do with these thoughts. They're very scary to them. And then when they tell people don't always understand what's going on with them either, right? So, or they try to reassure them and that doesn't work. So you can definitely see some what we call disruptive behaviors where kids might be verbally or physically aggressive or have a lot of meltdowns. They also might be incredibly exhausted after coming home from school. So maybe they've held it together all day long while they're in school, kind of because they know these are odd behaviors that I'm doing. And so then they'll come home and they're wiped out. They're just emotionally exhausted. So you really can see that with both little kids and adolescents. That's a common pattern to see with them. But I think for kids and adolescents, really hiding their symptoms for quite a while until they just can't is a really common pattern that we see, and just really not understanding why they're doing some of the things that they're doing. And not knowing how to talk to an adult about them. That's one of the most common things. The other thing we see in kids is that they have a high risk for other anxiety disorders and depression too if they have OCD. In boys with OCD, we see higher rates of having tic disorders. So more often see boys with like verbal or motor tics if they have OCD whenever they're younger, and they tend to present younger. So they might present in elementary school. In OCD in children and adolescents, there can be some difference, although their OCD domains can present pretty much in any age and stage. But the big differences are most likely to be that the young ones are going to be more externalizing in their behaviors, having the tantrums, whereas the adolescents might be more withdrawn in their behaviors. If they're having these odd thoughts or doing compulsions, they're going to be more likely to try to hide, adolescents will, their compulsions because of the social development that they have that's appropriate, right? They know that their friends are going to think it's odd. So they're more likely to hide them, whereas kids, little ones, are more likely to have the externalizing piece. Also, just the type of OCD can be different. Like I said, at any age or stage, you can have any kind of OCD, but in little ones, we tend to see a lot of just right OCD, a lot of contamination, a lot of worries about if they're wet, meaning like if they've urinated, which, there's potty training that's happening, right, whenever we're young, and so it makes sense. Whereas whenever you're a teenager, you might have other things. So you might have, OCD related to sexually intrusive thoughts, to relationships, those kind of things too, because that's more part of your development in those ages.